Hi, in this lecture we will start our study of the reproductive system. This lecture will focus on the anatomy of the male reproductive system. However, when we look at the reproductive system, we know that it is categorized as having primary sex organs, which are known as the gonads. These are the organs that actually make the gametes, the sperm and the egg, as well as the hormones. So the gonads, or primary sex organs, will be the ovaries and testes. We also know that the production of gametes is going to occur through meiosis. And when we looked at meiosis and mitosis in previous semesters, remember that you have your main cell, your stem cell, and that's going to end up forming 4 daughter cells. Each will be haploid. And the term haploid means that they each will have half as many chromosomes because all of the parent cells in your body have 46 chromosomes, or 2 pairs, 2 sets of 23. Now, when that sperm and that egg are going to fuse for fertilization, that will form the zygote, which is going to have 46 chromosomes and be known as the diploid number. The accessory organs are basically going to form what's known as the reproductive tract. So they're going to be transporting those gonads from the inside of the body outside, and they also will form the external genitalia. When we look at the reproductive systems, the male's basic job is to make sperm and deliver it to the female. In fact, it's estimated that males produce 500 million sperm every day, whereas the female's job is to produce the eggs, or eggs are also known, as you'll see shortly, called oocytes. And their job is to get that egg, and then once fertilization occurs, then to incubate. The embryo and fetus, as you know, develops inside the female in the uterus, and women generally produce 1 gamete every month. Both of these organs are going to release hormones. So when we look at the male reproductive system, we start with the gonads, or the testes, and you probably know they lie outside of the body in the scrotum, which is a sac of skin. And these gonads are going to be important because they're going to produce sperm, but also the male hormones and androgens, which testosterone is the main one. And if we were to look at the testes, the sperm are going to be produced, but they're going to have to get out. And so they're going to travel out through this system, these accessory organs that we'll be going over. So if we take a closer look, we see the testicle, or testis, inside the scrotum, outside of the abdominal pelvic cavity, and as we mentioned, the testis is going to make sperm and testosterone, and they're going to get their supply through the testicular artery. So when we look at those models in lab, remember to look for the genitalia. They were removed from this one. If we see the uterus, then we know that this blood vessel here, and you can see it coming off the aorta. It's a little small in this picture, but we can see the testicular artery and vein. And remember, if we had a uterus, we call it the ovarian artery and vein. So you'll check the model for the male reproductive system. And the testicular artery will be carrying the blood supply. Now, when we look at the testes, we know that they actually start internal, inside the body. Then obviously they're outside of the body. And so you can see this passageway, or channel, or tube, that is going to connect the testicle to the pelvic cavity. And it's called the spermatic cords. And if you look inside these cords, you're going to notice that you're going to see some fascia. There's muscle on the outside of it. And inside are going to be branches of your blood vessels, your testicular artery and vein. There'll be lymph vessels and nerves, all transporting and moving down to the testes. And they actually pass through your groin, which is known as the inguinal canal. And you can see in this picture, here's the hip, there's the head of the femur, and you can see basically the groin. There's a ligament here, and they have to pass through that. Now, you also notice the abdominal muscles down here, the lower muscles, internal, external, oblique. And so as they pass through this inguinal canal, this cord structure, as it passes through there, it also has to go through the lower abdominal muscle. So what can sometimes happen is an inguinal hernia. So a hernia is more of a weak spot. And what happens is you could have a weakness in the lower abdominal wall, and it could be severe enough that part of your small intestine protrudes, which would be very, very serious. And so what happens is you could have a piece of the intestine kind of push on it, bulge, or even push through. A lot of times if you have a lot of pressure, like if you're lifting really heavy weights and you're not breathing appropriately, then you can have issues with the hernia and you will have pain. A lot of times they can do this cough test where they'll have you cough and they'll feel the hernia move. And so if it's severe enough, then they're going to do surgery and put a mesh over that to prevent that from popping out like that. The other thing, as I mentioned, is the testes actually start internally as a fetus, and then they have to descend to get outside of the body. So again, as they descend, they're going to go through that inguinal canal inside your spermatic cord to get outside. Now, sometimes they don't descend properly, and this is called cryptorchidism. So sometimes it's only one, sometimes it can be both. And so for whatever reason, they're not sure exactly, there does seem to be a genetic piece to it, they don't descend properly. So if not corrected, there's a lot of different complications. You can get this torsion, which is very severe, has to be dealt with immediately. It can cause infertility and increase your risk of hernias as well as cancers. Now, the scrotum is just the skin, and the scrotum is going to have two cavities inside it. So this kind of like bluish gray area represents the scrotal cavity. Notice that each testicle is going to have its own cavity, which is important because this is going to prevent any infection from traveling from one to the other. So again, just real quick overview, there's two testes, right? Two testicles, but there's only one scrotum, one sac that is going to support those. Now we look inside the scrotum, there are some muscles here. The raphe, we're not learning that piece of it, but we are learning the dartus muscle as well as the cremaster. So the dartus muscle kind of lines, it surrounds the outside of the testicle, and it's just under the scrotum, and that's what makes it look kind of wrinkled, is that how that's arranged. And then we have the cremaster muscles, you can see them here, and so these are skeletal muscle, and they can contract or relax, and when they contract or relax, they're going to pull the testicles either closer to the body to make them warmer, or relax and let them hang further away. So this is why when we looked at if the testicles don't descend, it can cause infertility, because we know that it's actually cooler away from the body. It's about 2 degrees cooler out here in the scrotum than it would be internally. And we know that that temperature really affects the sperm. So it's very important to have the right temperature for proper sperm formation, which would obviously affect fertility. So when it's very, very cold, the cremaster muscle will contract and elevate the testes to keep them closer to the body. And when it's very, very warm, they're going to relax and basically let them hang a little lower. So there's been some research into if there is a fertility issue to check the underwear of the guy. If he's wearing tighty whities, that's probably holding your testes up closer to the body and maybe making them warmer. Whereas boxers are going to give a little more freedom and keep the testicles further away from the body to keep things cooler. If we were to look inside each testicle, inside each testes, we'll notice that we see these little areas, these lobules. So it's separated out into lobules, and these lobules contain these tightly coiled tubes, and they're called seminiferous tubules, so these yellow things. So these seminiferous tubules are extremely important because they're going to form the sperm. We mentioned that the testes are going to make sperm. So we were to look at one seminiferous tubule, we see a whole bunch of cells here. And so the cells that are out here are basically your stem cells, spermatogonic or spermatogonia cells. And then they're going to undergo mitosis, and then those cells undergo meiosis. And so as the cells change and go through meiosis, they're going to form the sperm and the lumen. So the seminiferous tubules are going to form the sperm. Now there's some other cells that kind of hang out. They're called nurse cells or sustentacular cells, and these are here to help the sperm be able to complete meiosis. The other cells we see are called the interstitial cells. So we look at the testes, you can see all these seminiferous tubules, they're making the sperm, but if we were to look between the tubules, we're going to see a little cluster of cells, and these clusters are called interstitial cells. So inter means between. Here's another view of a seminiferous tubule. There's the lumen, that's where all the sperm end up. That's how they leave as they funnel towards the inside and they're produced. And then the interstitial cells are between them, and the interstitial cells are important because they're going to make testosterone. So the sperm are made in the seminiferous tubules, and then they drain out. All of these tubules are going to drain into these efferent ductules, which are going to take it into this coiled structure called the epididymis. So the sperm move from the seminiferous tubule to the efferent efferent ductules down to the epididymis. Now, testicular cancer is something that's more common in younger men, so it is important to do a testicular self-exam. They usually say like monthly, just palpate to feel for any lumps. Testicular cancer, again, is more common in the younger males, and typically you'll feel a mass, and it's important to catch this early because if it spreads, it can be fatal. So you can see some common signs and symptoms of testicular cancer, and then they can diagnose it with blood work, ultrasound, and then they can go in and remove the tumor or do radiation or chemotherapy. If it's not caught early, as with all cancers, it can metastasize. So we need to look at the reproductive tract. We know the sperm are made here in the seminiferous tubules. How do they get out? Well, it starts with the epididymis. The epididymis is this coiled structure. Notice it's on the posterior side of each of the testes. It's pretty long. You don't have to memorize it, but 23 feet coiled, and it picks up all the sperm from the efferent ductules, which are draining the testes. Now, this is going to be smooth muscle when we look at this. And so as we're looking at most of the structures of the reproductive tract are smooth muscle. And so it's going to use peristalsis as it passes through. And pretty much while the sperm hang out in the epididymis, the cells there kind of monitor any of the fluid that's produced. They monitor the sperm. They store the sperm. In fact, the sperm can hang out there for 2 weeks, and they also protect them. Now, once the sperm leave this epididymis, this coiled structure, now they go through this long tube. It's called the vas deferens or ductus deferens. There's a simpler version of it here. There's the epididymis, and you can see this really long tube. And so again, just like everything else, it's smooth muscle. It's going to use peristalsis, and it's going to travel. Notice it's going to go up through the groin. So it goes up through the groin, through the inguinal canal, and then it wraps up through the pelvic cavity. And then this tube is going to wrap all the way around behind the urinary bladder. And then once it gets near the prostate gland, it's actually going to blend into the ejaculatory duct. So you want to make sure you see it comes into the ejaculatory duct, and then it's going to enter the prostate gland and go into this prostatic urethra, which we'll look at shortly. So this is a very long tube. It basically just moves the sperm, and sperm can hang out here for months. This is where a vasectomy occurs. So it's an outpatient procedure. They can go in and cauterize the little vas deferens. So the sperm are still made, but they can't get out. They're never going to make it up there into the urethra. And so usually they're just broken down and reabsorbed. It does take a little while to heal, and you have to make sure that you're using other forms of birth control because, again, it takes time to heal. So there is a chance you can get pregnant within a few weeks. I think they actually tell you it's a certain number of days, but I had a student tell me they even go as far as to say it's a certain number of ejaculations until you're kind of like cleared to not have sperm in there anymore. If we were to follow, so here's your ductus deferens, I don't care if you call it ductus deferens or vas deferens. Notice it comes around behind the bladder. And then this thing here, there's 2 seminal vesicles. They're going to make semen. But if we follow the vas deferens, notice it comes down into the ejaculatory duct. And so the ejaculatory duct, I'll try to color this kind of blue here. That's where the ductus deferens ends, and then from there it's going to continue into what's called the prostatic urethra. So it's at the ejaculatory duct. It's going to pick up semen from the seminal vesicles, but we'll get there shortly. Now we're going out the urethra. Remember, there's 3 parts for the male urethra. The prostatic urethra, which goes right through the center of the prostate gland. You're going to have the membranous urethra, which is very small and like a muscle layer, pelvic muscle. And then you have the penile urethra, which is going to go all the way through the penis, as it says. We also call this the spongy urethra, so you can call it either way. And in this mid-sagittal view, you can clearly see the prostatic urethra. There's the ejaculatory duct, and then you can see the real short membranous urethra, and then the rest of that again is penile or spongy. So when we look at the penis, obviously it's the copulatory organ, and there's three general parts. So you're going to have the root, which is just where it's attached, and then you're going to have the body, which is the shaft of the penis, and the glans is the tip. Now the glans may or may not have foreskin on it. So the foreskin is called the prepuce. This would be circumcised when the foreskin is removed versus uncircumcised. And there's something called smegma, which is kind of the weirdest language, weirdest word. Let me try that again. It's actually the Latin word for soap, and it's actually defined as being like a white cheese-like substance, and it's typically found under the foreskin of an uncircumcised penis. It can also be found between folds in the labia on the female, or if you have a really obese patient, it can develop between fat folds. So it's kind of like a sebaceous gland secretion. It's oily, it's white, it can be smelly. It's not going to hurt you, but it's just something you want to make sure that you take care of when you bathe properly. And then if we were to look inside the penis, notice that you have this blue and red sponge-like stuff. We know we already have the urethra, but it's going to have this special erectile tissue. So that's what this sponge-like stuff looks like. And there's two of these. It's called the corpora cavernosa, or you can call it the corpus cavernosum. So you can pick your first word, corpora or corpus, pick your second word, cavernosum or cavernosa. It doesn't matter to me. The other one is called the corpora spongiosum. So if you think of the spongy urethra or the penile urethra, if you call it the spongy one, you'll remember this one's right around the urethra. And then the cavernosum, right? Cavernous, very, very big. So we go to this view, the corpora spongiosum directly surrounds the urethra, where the cavernosum is out here. It's much bigger. But both of this is erectile tissue. So what that means is that when your parasympathetic nervous system is activated, it releases nitric oxide. And you probably remember that nitric oxide is a vasodilator. So blood flows into the penis, into these spongy tissue, and that's what gives you the erection. We also know that the internal iliac arteries are our arteries that are bringing blood to the penis. So it's a vascular event. Now, we talked about the sperm and how they get out. We need to come back to the accessory glands, and there are three glands that make semen. We have the seminal vesicles, which you saw. They're on the posterior wall of the bladder. They make most of the semen. Roughly 60% of the semen is produced here, and it's a pretty alkaline, thick solution. If we were to look at what is found in semen, we know that there is fructose in semen, and fructose is the nutrition for the sperm. Sperm are the only cells that use fructose for energy. And so you need it in the semen because they have to swim so far for fertilization. There's going to be different prostaglandins that are, remember, these are hormone-like chemicals. So they'll cause smooth muscle contraction. They help the sperm swim. And then there's even some fibrinogen inside semen. And so this is also made by the seminal vesicle. And it, just like in your blood, it forms a clot. Well, what it's forming a clot of is the semen. So when ejaculation occurs and the sperm and semen are deposited inside the female, it forms a clot. So it basically doesn't all just like drip back out, because you want the sperm to be able to swim and go up to that oocyte. Now you'll notice that the prostate gland is going to make a lot of different secretions, and the prostate gland is this donut-shaped gland inferior to the urinary bladder. And so when the prostate gland releases its secretions, it's going to go right into the prostatic urethra. So this fluid is more like an alkaline, it's more like a milky white, and it has some different substances in it. Again, you can see some of them here. It has citrate, otherwise known as citric acid, that does help with fertility and helps the sperm become more mobile. It has this prostate-specific antigen, PSA. So this is an antigen that's produced. It does help break through cervical mucus, and it's an antigen, like a cellular ID card. And so that PSA is done to kind of check the health of your prostate gland, and it's an early indicator of prostate cancer. So if these PSA levels start to go up, it could be a warning sign that prostate cancer is developing. And there's also seminal plasm, which is basically an enzyme. It's an antibiotic enzyme. And we know that one reason why males have fewer UTIs is because of these components in their semen. Now, with the prostate gland, you can have BPH. Notice it's called benign prostatic hypertrophy. And so what happens is the prostate gland is going to start to enlarge. And when it enlarges, it pinches off the urethra, so the urine can't get out. So the male's going to have frequent urination. They're going to have to go quite a bit. And when they go, their flow will be slow because it's kind of pinching that off. Now, you can palpate a prostate gland rectally, so it can be done in a digital exam. And you can also do ultrasounds, and then you could do the blood work, as I mentioned, for the PSA. I'll get there shortly. But if you do have hypertrophy, a lot of times they'll put you on an alpha blocker, an alpha-1 blocker. And remember, an alpha-1 blocker works in smooth muscle. Well, this is smooth muscle. So what it does is it blocks so that the calcium can't enter, and it causes dilation. So now the urethra opens up, and now you've increased that space so that the urine can be eliminated. The other condition is called prostate cancer, which can occur. And so you can see some common signs and symptoms of prostate cancer developing. Prostate cancer is fairly common in males. It's usually in older males, but it can also happen in younger males. And it's important that you get tested regularly. So they'll do that PSA test, and you really want to watch that. If that starts to go up, excuse me, they can palpate it and they can do imaging. So if something is off, they'll do a biopsy, because if you look at where the prostate gland is, it can spread. This cancer can metastasize, unfortunately, and it's fatal a lot of times once it starts to spread. And so, they have different treatments they can do. They can do radiation. They put like a little radioactive like bullet in the prostate gland. They implant that to try to kill it. They do radiation, chemotherapy. There's hormone therapy to try to treat the prostate cancer. If we look at this image now, this is your lab model. The other gland that's left is called the Cowper's gland, or bulbar urethral. Now, bulbar urethral is really hard to say and spell, so I'm fine if you stick with Cowper's gland. It's this little white one. So in this image, the number 1 is on a seminal vesicle. 2, this whole thing is the prostate gland, and there's the little Cowper's gland. So that tends to make a real alkaline mucus. It's thick, and this is what's going to come out in what you probably call your pre-ejaculate. You probably have some other terms for that. And so its job is to be released first to kind of go through the urethra, because urine could be acidic. And so it's alkaline, and it neutralizes that urethra, because the urethra transports urine, but then it also transports our sperm. And we need to make sure that that's not too acidic for the sperm. So it's very important. And it also helps to lubricate the area as well. And then again, we talked about the semen, typical ejaculate, roughly 2 to 5 mLs. You can do a semen count. You can look at how much fluid and the components of semen if there are issues with infertility, as well as doing a sperm count. So usually there's abstinence, and then you get your sample, and you can measure that as well. So a lot of times they'll look at the amount of ejaculate, they'll measure the sperm, and they'll even look at the chemicals in the semen. We already talked about most of these, but we know that there's lots of nutrients and chemicals and enzymes, and they're all here to help with fertilization. Some chemicals do what's called capacitation. I'm not going to really ask you that question on your test. It just helps activate the sperm. There's some proteases. They're going to help break down protein to get through that cervical mucus. And even some prostaglandins trigger the uterus to do reverse peristalsis. So it kind of like sucks the sperm up. We do know that the pH is slightly alkaline, 7.2 to 7.8 of the semen, because we know that sperm do not do well if the pH gets to around 6 or less. The sperm don't survive very well. So we want to have a nice alkaline fluid for those sperm to be transported in. So this wraps up our lecture on the male reproductive system anatomy.